Hello guys, welcome back to my YouTube channel. This is Miss Henderson. Thank you again for tuning in. So guys, again, I am creating these short videos to help the CNA students. So today I got some new questions for you guys. So we are going to be diving into these questions. So one by one, we are going to be doing these questions. Again, please consider subscribing to my YouTube channel. Please like and share, and please drop a comments on this video. And let me know what else you would like me to create for you. Thank you again for watching. As I said, we're going to be doing one by one of these videos. Okay. So we got the first question here, and it states, vital signs and observation. While taking an elderly resident blood pressure, you notice it records 85/56. So 85 is the systolic and the diastolic is 56. And the resident complains of dizziness when sitting up. What should you do first? So think about it and think what you think is the correct answer for this question. It is not a difficult question. You can get this one. This one is very easy. So the correct answer is C. Lay the resident back down and check for safety. And you have the rationale right there. It tells you the situation suggests orthostatic hypotension. The immediate action is to prevent falls or injury by laying the patient down once stable. Check the vital signs. That's the correct answer. Okay, let's look at this other question. We got a question here on infection control. A CNA is removing contaminated gloves after providing perineal care. Which steps should come immediately after removing the gloves? This is another easy question, guys. The correct answer is perform hand hygiene. So at the beginning of the skill and at the end of the skill, you should perform hand hygiene. That's the answer. Let's look at another question. Positioning comfort. When positioning a resident with right-sided weakness, which side should be moved first? The strong side, the weaker side, both sides together, it doesn't matter. It's the stronger side. Always move the stronger side first when assisting with transfer or repositioning. This helps the resident to use their stronger side for support and balance. Cardiovascular system. A resident suddenly clutches their chest and becomes pale. Clutches their chest and becomes pale. So what will you do as a CNA? This is somewhat challenging question. The correct answer is B. Activate the emergency response system. Question number 4. Guys, I'll be right back. Yeah, I needed to get some water. Okay, during a bed bath, you notice redness and slight skin breakdown on a resident's tailbone. What is the best action? Correct answer is document and report the findings to the nurse immediately. Early pressure injury detection is vital. Do not massage the area. Question 5. When assisting a resident with a gait belt, where should the CNA stand during the emulation? B. On the resident's weaker side and slightly behind. That's the correct answer. Standing on the weaker side gives better support. Nutrition and feeding. A resident with dysphagia, difficulty swallowing, is coughing while eating. What should the CNA do? Stop the feeding immediately and report the findings to the nurse. Let's look at another question. I think that was the last question, guys, on nutrition. So guys, again, if you like these questions, please consider subscribing to my YouTube channel. Please like and share. Oh, actually, we got another question here. When collecting a clean cat's urine specimen, which action is essential to ensure accuracy? The correct answer is B. Use sterile gloves and collect midstream urine. Use the sterile gloves and collect a midstream urine. That's the correct answer. I think that was the last question, guys. I don't think I